Hi everyone. So I got a whole bunch of questions from you guys about being a doctor, how it works, how do you get there, how do you manage it, should I do it, why I did it, all kinds of stuff like that. So I decided to break it down into a bunch of different videos, and I am going to approach this in the same way that I approach when I discuss radiation for my patients, which very often what I'll do is just to kind of alleviate patients' fears and to give them some information. I'll first tell them about radiation, what it entails, how it works, and then we'll talk about whether or not they actually need it. So here I'm going to tell you about becoming a doctor, and then at a later point in time I'll discuss why somebody would want to do it, should they do it, and is it worth it, and those kinds of questions. So I'm going to read you the first question. So the first question is, were you always studious in high school? Did you have a GPA of above 3.5? So you probably won't be surprised to hear, yes, I was always very studious. I pretty much always did very well in school. I was valedictorian in my high school. I can't remember my exact average in high school, but it was very high. I went to Brooklyn College and I had a 3.99 GPA. You'll probably hear this from a lot of doctors. You know, medicine requires lots and lots of test taking, and the test taking doesn't end with college, because in medical school and residency you continue to take lots of tests. So if somebody finds test taking difficult for them, meaning even if they study they don't do well, medicine is probably going to be even more difficult for them. Now that doesn't mean that it's easy for someone who does well. Medical school is hard for everyone. There is no such thing as someone just sailing through medical school. If you don't study, if you don't put your time in, you will fail. So that brings me to question number 2, which is, how hard was the schooling? And I will be honest with you, like I'm honest with my patients. It's very, very, very hard. You know, like I said, there's no such thing as sailing through. No matter how smart you are, no matter how well you did until then, in order to pass your exams, even if you're in a school that's pass-fail, like NYU was when I went there, the reason why it's pass-fail is because passing is very, very hard. If it was easy to pass, then they wouldn't make it pass-fail. So the next question is there any way I can do my degree online? The answer is no. For undergrad, maybe some courses can be done online. I don't know anyone that did that for their undergraduate degree who got into medical school, because you need to take lots of sciences, and the sciences have a lab with it, and you need to actually be there in person. Also, you know, good 4-year colleges oftentimes don't have many courses available online. So if you're going to go to an all online, you know, degree, you're still going to have to do a lot of pre-med courses that's not online. Medical school itself cannot be done online. There are some courses where you don't have to come in, especially in the first and second year of medical school, but overall it is not a degree that can be done online. The next question is, how much of a financial investment is it? And I'll say, great, great, great question. Medical school is 4 years, and it usually costs about $200,000 in total. It's very expensive. If you are if you're married, if you have kids, a lot of times it requires even more money. So most medical students graduate with about $200,000 in debt. It could be more, it could be $300,000 in debt. And what's important to realize is that you are the one that needs to pay it back. Your school, actually any school you go to, but I'm specifically talking about medical school, they'll tell you, oh, everyone takes out loans, and that's true. But again, you are the one who ultimately needs to pay it back. and residents do not make enough money to pay back their loans. So almost all residents who have loans will go into something called forbearance, which means legally you don't need to pay it back while you're a resident, but the interest continues to accrue. So I would say that the high cost of medical school is something to very, very seriously consider when deciding whether or not that's something that you're interested in doing with your career. The last question that I'll answer for today is, what did you write your personal statement for medical school admissions? And believe it or not, I totally do not remember what I wrote. I started medical school in 2006, but thanks to Google, I actually was able to pull up my personal statement. And it turns out that I wrote about a bunch of different things, but I started off speaking about how when I was 12 years old, I was very overweight as a kid, and I decided to lose weight, and that was a very eye-opening growth experience for me. And then I spoke about my parents, who are both doctors, and the influence that they had on me. I would say people overestimate the importance of the personal statement. There's so many other things in the application that whoever's interviewing you needs to review. Grades are obviously very, very important. Shadowing experiences, research experience, all the things that demonstrate that you know what you're getting yourself into and this is something that you really want to do. The personal statement is really a place for you to discuss anything that's not already in your application. So if somebody, for example, had cancer as a child, there's no other place to put it except in the personal statement. So that's an opportunity for you to share something about yourself. If you're like me, you didn't really have anything too exciting to talk about, you just kind of, write something nice, a little story, and move on. I would say the most important thing with medical school applications is to get it out as soon as possible, because even places that say they're not rolling admissions, they still have a stack of applications that they need to get through, and it's always best to be the first one in. On that note, have a wonderful day. Next up, I will talk more about should you go to medical school and what it means to have a work-life balance in medical school and residency and after.